Welcome to the webinar on Poverty, Hunger and Disability, the Missing Link. This is the fourth in the series of webinars, which we've been doing from the last years. And we are focusing, today we are focusing on towards living independently in community with dignity for all persons with disabilities. Now we move to Nepal. Mr. Matrika Prasad Devkota started experiencing psychosocial issues when he was 15, but it wasn't till 10 years later that he got with psychosocial support. After his recovery, Mr. Devkota realized that despite having a favorable environment for recovery with his psychosocial issue, it still took 4 long years for his rehabilitation. Matrika is the first person who dared to come out and introduce himself as a person who was experiencing psychosocial disability on national television, and by breaking the barriers of silence in this biased and superstitious country, he has become a voice for the voiceless persons experiencing psychosocial disability, in which he wants to help ensure the rights of persons experiencing these issues to a dignified life through advocacy and service delivery. With this vision of mental health and psychosocial well-being for all, Koshish was established in 2008, and Mr. Devkota has been leading the organization as a chairperson, which is working extensively in advocacy as well as comprehensive recovery-based psychosocial support in Nepal.
And Koshish is the Sanskrit word. Koshish means making an effort and or to try. Especially Koshish, we came after the ratification of CRPD, and that had the paradigm shift that we are no more patient or mentally ill, but as a right holder. And so that's the new era of CRPD, and Koshish is trying to have all the ways for the implementation of United Nations Convention on the right of person with disability. And still, likewise in the previous presentation, and it is health issue, but rather than health, it is more problem relatively is more to the barrier that person have to suffer a lot medically, but relatively the person have to suffer a lot because of barriers and prejudice, and also the legal barrier and the legal capacity is taken away and isolates the guardianship, and in Nepal, isolates in many neighboring countries in South Asia and many parts of the global South. Next, please. Next slide, please. And Koshish model is bringing the right holder together and then promoting peer support and this isolated group and stigmatized population, bringing together and creating a platform to ventilate the distress. And also peer supports are quite not very organized group. These are, but these peer support people are welcome to join in the self-help groups. And these self-help groups are more toward the community-based organization. This self-help group are formed as a new organization, person with psychosocial disabilities, OPDs. And we extensively work in peer support and self-help groups and further meaningful and effective rehabilitation. And we focus on economic empowerment and in the beginning, and our core fund, and we are the lead experience organization. We are the one designing and implementing and monitoring and evaluating the thing, what is useful for our life, and we're trying to give back to our community. Next, please. Next slide, please. And so the thing is now our progressive realization is going through the only from health lens and focus of the medical model, and it's not, we need to have holistic model, and not, I'm not saying that we need medication, we need support, but these health support should be linked with the government mainstream services, social protection, education, livelihood. So we are linking this right holder to duty bearer in Nepal, like the local government and provincial and federal government. So we are linking with the mainstreaming services and for the mental health issue as well. And next please, next slide please. We have working extensively, more than 5,000 students are trained about mental health and psychosocial well-being, and also public awareness. We work in radios program, we work in television program, we reach out the entire country, and also we're able to help and so many people who need psychiatric support and counseling support and this kind of support and specialized support also in the community, more than 8,000. Next please. Next slide please. And we also work with extensively in the local system from the female community health volunteer. They are the grassroots body. And also we work in the education system and also training teacher. As well as we are working with duty bearers and parliamentarian, judges, bureaucrats, and constitutional bodies members sensitized about the legal provision of the rights guaranteed by the United Nations Convention on the Right of Persons with Disabilities. We are also working for the reform. So, like all discriminated laws, they are related with the mental health, psychosocial issues. We have a file in the Supreme Court for dismissal of abolishment of this kind of a discriminative provision, and also parliamentarian for the legal harmonization in line with United Nations Convention on the Right of Persons with Disabilities and other human rights treaties. Next, please. And also, we are able to help more than 1,000 women who were abandoned in the street and with violence, abuse, and and we are helping them extensive support and long run. And these women are rehabilitated in their family and communities and with effective and meaningful inclusion. I'd like to recap. One of the things, like I'd like to share my live experience. Treating just people is not enough, but treating with the structural stigma barrier, and rather than people with the mental health issue, the problem is within the family, within the society, within the system. And so we must focus on destigmatizing, and also these people are being advocate and activists, and these people are running the peer support and self-help groups. And now we are now training to the professional what is useful for the people, rather than what people, what people we think, but what people need. And so we are also training in line with United Nations Convention on the Right of Persons with Disabilities for quality and dignified and effective and meaningful participation of the right holder. Thank you so much for this opportunity.